Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. In this podcast, we will be deconstructing and highlighting the different aspects of grief and loss. I'm your host, Dr. Christina Zampatella. Hello, this is Phoenix Rising with Dr. Christina Zampatella. I am excited to talk about disenfranchised grief today with Dr. Rebecca Morse. This topic is, for me, as a clinician, as a professor, as a presenter, one of the top three topics to address when it comes to looking at death, loss, grief, and trauma. When I do present, I will say this, and I'm going to say it right now. If the only thing you get through this whole, for example, 12-hour certificate program I'm doing, if this is the only thing you get out of this certificate program, I want you to leave with an understanding of what disenfranchised grief looks like. Not only disenfranchised grief from other people, but also this kind of auto-oppression, our own disenfranchisement of our own grieving process. So I'm very excited to be able to talk to you today and Dr. Morse about what disenfranchised grief is, the different types of disenfranchised grief, and how that impacts how somebody is grieving and what they can do when somebody is feeling disenfranchised. So first, I'd like to introduce you to Dr. Rebecca Morse, and I'm hoping you can tell us a little bit about you and what you do and what your roles have been and your education and, you know, what your favorite color is, like whatever works for you.
Well, thank you.
Sure.
It's wonderful to be here. So my name is Dr. Rebecca Morse, obviously, and I am a developmental and behavioral psychologist, and I'm a thanatologist. So I specialize in the study of death, dying, bereavement, grief, and loss, predominantly. And I've had an opportunity to wear many hats under that thanatology jurisdiction. One is I was one of the presidents for the Association for Death Education and Counseling, which Dr. Z had called me out on earlier because I had neglected to mention that in a prior podcast. But I'm also Dr. Virginia America 2022, and that is a public education approach, and mine is on death education.
So you didn't have to get in a bathing suit?
No.
Okay, good.
No.
All right. Because you couldn't have caught me dead doing that. But all right,
you
gotcha.
couldn't pay me to do that. No. But it's on different health or educational platforms, and mine is on death education.
Okay.
And it's funny because as you were talking about how important it is to know what disenfranchised grief and the impact of that, one of the things I always tell my students is that it's not that grief itself is disenfranchised, it's our experience. It's that human element of it. And there are different components to that, which we're going to be talking about today in this podcast. But we're going to unpack what's disenfranchised.
Right.
And what does that mean for me as a griever? And what does that mean for someone in my world who might be grieving?
So, can you define disenfranchised grief? Knowing Ken Doka is the one that originally coined that term, I think around the 1990s when he was looking at people who were suffering from HIV or AIDS. Yeah. Do I have that right?
Yeah. Late 80s, early 90s.
Okay, gotcha. Can you define that for our viewers and listeners?
Yes, and I think it's something, though, that it's important to recognize that the definition is absolutely rooted in the description of what it is. And so when we say something is disenfranchised, we often are saying that it is invalidated. And I think at the core of it, that's what disenfranchised is. It's invalidated. So when we say disenfranchised grief, what we're really saying is that the grief or the griever is invalidated. Mm-hmm. It doesn't have social capital. It doesn't get respect or honor or space.
Right. In order for the person to integrate that loss.
Exactly.
Right. It interrupts that process.
Exactly. So when we talk about disenfranchised grief, DOCA and others who have, relied on DOCA's foundation, they've broken it down into different domains of disenfranchised grief or loss. And I really want to emphasize the fact that it's not a stage theory, it's not in order.
Right.
They're categories. And categories just mean it's a little bucket where we can place something. And so any one person's grief experience may actually fit into multiple buckets. But for description's sake, sometimes it has more of a home or more real estate in one bucket rather than another. So as we're categorizing it, we may place it in one or the other, but they overlap a little bit.
Sure. And the bottom line is no matter what bucket or whatever it's in, the main thing is it being recognized? I don't care what bucket's in. But I'm hearing what you say is that there's privilege maybe from in one bucket or the next. So I like the way you're saying that, like, wait a minute, it doesn't fit in this category. So is it? No, we're not trying to make it that difficult. We're trying to recognize and identify it.
Exactly.
Okay.
Well, and I have to say, I think this is, of the topics we've discussed, I think this is one of my favorites because, we talked about stage theory, and that one always gets under my skin. It makes me a little itchy. This is so important for people to understand.
It is.
So when we talk about these different categories, and often they talk about the 5 categories, although some theorists like to lump a couple of them together.
And then some added a couple after that, but let's,
But if we're talking about it holistically, one of the first categories is that of the loss itself is not acknowledged or identified as being a loss.
Right.
So it's not just saying that the grief is disenfranchised, it's saying that the loss isn't a loss.
It's almost ambiguous.
Yes.
We talked about that in another podcast.
Yes.
Absolutely.
Ambiguous. It could be a non-death loss, but it can also be losses that are not socially appreciated or sanctioned as being a loss. So an example of that can be any element of our identity. There can be grief that is part of losing an aspect of your identity that others may not see as a loss, but there can be significant grief associated with that.
Okay, so when you say a loss of a part of identity, what do you mean by that?
So a very poignant example that I think we're seeing around us right now are those who they're working through their gender identity.
Okay.
And so an example of a loss that's not even seen as being a loss is you can have someone who's going through a transition in their social expression of gender. And that may involve medical intervention. It may involve changing your name or changing how you present yourself to the world. And there can be a lot of joy in that. There can also be a lot of grief in that. And unfortunately, that kind of grief can be very disenfranchised because you have people who are those who aren't comfortable with the transition, maybe saying, well, you didn't have to do this. Why are you doing this? You're
or even, how dare you do this? I mean, complete rejection of it.
Exactly. You were rejecting who you were.
Right.
Therefore, what grief could you possibly have?
Right.
And there can be those who advocate for the transition who are saying, well, this is what you want, so why would you have any grief with that?
Right.
Get that behind you. But that person may be struggling with that sensation or that oscillation of a foot in both identities as they're navigating that.
So losses like relationships or health. I remember being diagnosed with epilepsy when I was 20, and just it changed. I now I can't take a bath. Now I can't go scuba diving. I'm not climbing up on ladders. Like, and it's a hidden. As long as you're not having those seizures in front of people, it's a hidden disorder.
Absolutely.
But you grieve that. A job, a miscarriage, an abortion. Well, you didn't want the child. Are you kidding me right now? Are you kidding me right now? Like just these like you said, these non-death related losses.
And I'm going to circle back to the miscarriage and abortion
Okay.
when we get to one of the other
Oh,
categories.
and I know where you're talking about. Okay,
yeah,
go ahead.
It
Sure.
fits, again, this
It
is where
fits.
you have
Yep.
real estate in both categories.
Right.
But with these non-death losses, you had mentioned relationship. That really is a component. It's when others aren't holding space for you to grieve and acknowledge that was a loss.
So this almost being its own category is like not even recognizing the importance of the relationship itself.
Mm-hmm.
So would you consider that another category of disenfranchised grief?
Potentially, yeah.
Okay.
And you can also have ambivalence,
Mm-hmm.
can be a part of it as well. So, with well, I'll save that. But there are a lot of things that fit in that. And
Mm-hmm.
I think when we're saying it's not socially recognized as a loss, a lot of non-death losses will fit into that category.
Yeah, absolutely.
Now, when we look at the other categories, one of those is the type of loss. So not the type of death, but the type of loss. And so for me, one of the just foundational examples, and this comes from my own experience, is pet loss would be an incredible example of that, because it is a loss, it is a death, but it's not one that until very recently has gained any acknowledgement in society
Mm-hmm.
as being something you can grieve. And, I said my own personal explanation and example of this. Even when we know what disenfranchised grief is, we can still disenfranchise ourselves. So this
Absolutely.
is a double loaded, and that's
Absolutely.
why I'm going to show. So I had this cat. I loved this cat. She had a rare autoimmune disorder. And when I was going through premarital counseling with my fiance, my dad was having some health issues. My brother, who was taking care of my father, was under a lot of stress. So I had my fiance, my father, and my brother driving me nuts. So go into this premarital counseling session and sit down. Pastor goes, well, how are you guys doing this week? My fiance does this, meaning you take the floor. And I looked straight at that pastor and I said, I love my fiance, my father, and my brother more than any other men in the world. And right now, I love my sick cat more than all of them put together.
Mm-hmm. What did he say?
He laughed and then shared an example with his own wife and their cat.
So he was able to validate it.
Absolutely.
That must have been such a relief to have him validate that.
It was such a relief. So I share that just to set a context for then when that cat did die. I was wrecked.
Mm-hmm.
Here I am. I'm a thanatologist. I know all about disenfranchised grief.
Mm-hmm.
Did I call my boss and use my personal leave and say my cat died? No. I lied and said I was sick. I mean, I wasn't lying. I was sick. I was vomiting. I was so grief-stricken.
Right.
But here I am. I should know to advocate
Oh,
for
you're
pet
not allowed to
loss.
shit all over yourself like anybody else.
Exactly.
Right. And that's the thing, right?
And
That lack of self-compassion, right? And the awareness of, wait a minute, this is huge. This is huge. Sometimes somebody's pet is the only other living thing in the home with them. They've been comforted with this unconditional love. And you'll hear things like, well, man, you can always get another cat. I can't get that cat.
Exactly.
I can't get that dog. That dog is that dog. There is no way I can replace that dog.
Although I will say I am an advocate for getting a pet quickly after.
Yeah.
Because it fills the void in your life.
Mm.
You lose your mom, you can't go to Moms R Us. You can go to PetSmart and adopt.
That's true. You can do that.
So I am going to put that little plug
That's
in there.
okay. We can have different feelings about it.
Yeah. But I share that because it's such an iconic example of where our society doesn't fit. And this is not universal.
Yeah.
Not all cultures put that sort of weight on that relationship.
Sure.
But if your pet dies or your pet needs cancer treatment, there's no FMLA. You don't get family medical leave for your cat or your dog or your goldfish, right? It doesn't exist. And we don't have a funeral or a memorial.
Unless you create it, right? But it's not culturally prescribed.
Exactly.
Right.
And that's where you can feel very isolated in that grief, because it's not about the actual what that loss was. It's what that loss meant to you.
Right.
And there are so many other category or types that fall under that. So you had mentioned before with abortion or miscarriage.
Or infertility.
Infertility is a huge one.
Yeah.
And in infertility, very much there's that ambiguous component to it. And what people may not realize is that every missed menstrual cycle, or where it could have been a pregnancy, can be a grief and a loss. Even if there was no miscarriage, it's the loss of what could have been. And I think that's what's really crucial. Same when we talk about an elective termination. In particular, if we're saying if there was an embryo or a fetus that had some sort of developmental disability, you have those who advocate for those with developmental disabilities saying, oh, you should carry it to term anyway. And those who are in favor of an elective termination in a multitude of domains, who are saying, well, you made the best decision. Well, you can feel comfortable that you made the right decision for you and still have grief.
Sure.
Similarly, you can't be prescriptive with this, right? You may not have grief associated with that. There's individuality there. But unfortunately, we don't give space for those pre-being in the world losses.
Right.
So stillbirth, miscarriage. There's no space for that.
No.
I remember once I was in a hospital setting and I was talking to a couple, and I did not know that they had a very late trimester stillbirth. And I, just see that, oh, she's not pregnant. She was very far along. I'm like, how is everyone?
Oh my goodness.
And the husband just said, oh, didn't you hear? The baby died. Oh my gosh, I'm so sorry. Of course, I'm feeling awful, right? And the mom was just like, it's okay. Nobody, only a couple of people know so far. And I said, I just, being an innocent idiot of a 21-year-old, said, are you going to have a memorial? And the dad, who's got this very brash personality, says, why would we do that? It wasn't here yet. And the look on the mother's face, she crumbled. And you could just tell that she wanted that.
Wow, that must have been hard, really, watching the two of them and the differences in the way that people grieve and how they cope. And
absolutely,
when I was in my first marriage, I got pregnant and I ended up miscarrying, and I was at the doctor, and the doctor's like, and I was young, 28 maybe, or somewhere around there, and he said to me, you know what, you're young. 1 in 3 pregnancies end up in a miscarriage anyway. You'll be able to get pregnant again, and walked out the door. Now, had I known then what I know now, I would have followed his ass right out that door. But I just sat there in complete shock, like I don't even know what to do with that.
That is like the jerkiest thing to say.
Isn't that the jerkiest thing to say?
It really is. And I used to work at an OBGYN's office, and I would hear people say that. Like,
what the hell? I mean, anyway, so I
that's
got
its own podcast.
But
what not to say.
Yeah,
there's
what not to say.
There's what not to say.
So that's the second category.
Yep.
Okay.
And then there can be elements around the type of death itself.
Right.
And there are many types of death that would fall into that, where it's disenfranchised.
Mm-hmm.
And I think the key here, and this maps onto, I know we're going to talk another time about stigmatized loss,
Mm-hmm.
but I think the key here is that we're saying that from a societal standpoint, in whatever society that is, that this particular type of death, for some reason, has a shame
Right.
associated with it.
Mm-hmm.
And so what happens is the grief is denied because of the shame present in that. And there are different types. It can be usually one of the textbook examples is a suicide.
Absolutely.
And that's its own podcast. So I'm going to transition on to looking at some of the others that may be
Sure.
less familiar for people.
Sure.
When you have right now, with the absolute epidemic of drug overdoses,
Mm-hmm.
there is a shame associated with that,
Mm-hmm.
and there's a lot of judgment from society. Well, your kid chose that, or your spouse or your sibling chose that.
I had a person, and I told this in my personal story, which was, I believe it's the first podcast, but about my brother dying from a drug overdose. And I was at work, and this woman came up to me, who I thought was a friend. And she was like, oh, I heard that your brother died, blah, blah, blah. Maybe if he had gotten into rehab sooner. And I'm thinking, maybe if I stabbed you in the neck with a fork, like that, probably. Like, what did you just... And I just looked at her, and I'm like, are you effing kidding me that you just said that right now? And like, it ruined... There was no way I was going to be able to say to her, that was the dumbest thing you could have possibly have said to me. And because it was so new. But the disenfranchisement of it, like you said, oh, it was a choice. This could have been fixed. You don't think he tried? Or even if he didn't, like, why do you need to say that? It just kind of blew my mind away. Yeah.
And I think one of the key things here is that, again, it's that shame component.
Yeah.
It can also be in situations where your person's actions or lack of actions led to the death of someone else as well.
Like homicide.
Homicide, or I was thinking even more, we've had an increase in car crashes since COVID.
Mm-hmm.
When you have somebody who's inebriated or intoxicated, they're high, and they take their own life, but unfortunately they kill someone in the process.
Sure.
And what can happen is that the family of the person who was driving, who was intoxicated, inebriated, under the influence, their grief is seen as lesser than the others because, oh, they were innocent.
Right.
And
right.
there's a judgment there.
There's
this almost this triage of how much grief you're allowed to feel. And I think that's one of the things that's so important about what Ken offers with this approach to recognizing disenfranchised grief, is that it's saying that it's not March Madness. There's no bracket system for grief. You can't just put, who gets more. It's not pie.
Right. HIV, AIDS.
HIV, and I was going to say
huge.
The other is what led to that component or led to the infection. COVID.
I was going to ask you about that. If you thought, because I remember when I got COVID and I was on the phone with you, and it was at the beginning of everything, and the level of shame that I was feeling, knowing I was going to have to tell clients, I was going to have to tell, people that I loved, that I had COVID, and how, like, the shame around it. Like, now it's kind of like, oh, you got it, okay, it's terrible. But it was almost like, oh, were you running around town? Did you not have a mask on? Did you not care that other people? And I remember you like talked me down off the ledge, but I was so upset about that.
And I had experienced the same thing. So I caught it before we had a vaccine. I stayed inside. We only socialized within like 2 or 3 people. Mask, gloves, hand sanitizer, you name it, I did it. And I still caught it. And there was an intense amount of shame because the first thing everyone asks, What'd you do? Where'd you go?
What'd you do? Yeah. Were you wearing a mask?
And
Yeah.
similarly, for people who lost someone to COVID,
Mm-hmm.
there were a lot of other deaths during COVID that were not related to COVID that have significant disenfranchisement just because of other aspects.
Mm-hmm.
But somebody dies of COVID, what's the first thing they asked? Any guesses?
The first thing they ask if they died from COVID?
Yeah, so I call you up and say, hey, I don't have an Uncle Jim. My Uncle Jim died from COVID. What's the first thing people ask?
Well, did he have other illnesses? Some people ask that. I feel
You
like
see,
I'm going to get this test wrong.
You are, but that's because she's a kind person. You're too kind. Because you're thinking with your clinician hat on.
Yeah.
The average person, were they vaccinated?
Oh, yeah, absolutely. Yep.
You had your clinician hat on, so I apologize. That's on me.
You don't apologize. No,
it was a trick test.
It was a trick. Okay, well, yeah. It was A or B, and I picked B, but it was A. But you're supposed to pick B if you don't really know the answer. That's my understanding. So we're just going to stick with it.
Psychometric theory, that doesn't work.
It really doesn't work?
No, it doesn't.
Oh, shit.
Sorry.
Well, all right. I still passed the EPPP. So
you know what they call someone who graduates last in their class?
Graduate?
Doctor. If they're doctor.
All right, so go ahead. Sorry.
So going back to it, were they vaccinated?
Mm-hmm.
There's judgment in that because
Sure.
what are they saying? They are saying that somehow that person chose to die because they weren't vaccinated.
And possibly chose to make other people sick.
Exactly.
Yeah.
There's anger, there's judgment, and there was a lot of disenfranchisement with that. And the thing is, even though now, as a society, at least here in the US, we've shifted toward being more accepting of COVID and vaccination versus not, that pain that was inflicted on those grievers is still there because they still bear the bruises of those responses.
Right.
Thank you for listening to Phoenix Rising with Dr. Z. If you found this podcast helpful, please share it, subscribe, and leave a rating or review wherever you get your podcasts. We want to be a resource for anyone who is experiencing loss, and this is a simple way you can help us spread the word. Check out our show description. There you'll find a link to connect with me on social media, as well as helpful articles and resources.